At Landmark, we do house calls. We take care of patients with chronic disease conditions, and we're able to bring the physicians, the nurse practitioners, the behavioral health specialists, as well as social work into the patient's homes. We're able to see things that the primary care physician would otherwise not be able to see.
Most people didn't go into healthcare to be able to see patients in 15-minute intervals. At Landmark, we provide 50 to 60 minutes for our visits so that you can address all of the complex issues that the patients have, really work on a lot of the health literacy and education so patients understand their illness, and then really developing that relationship and that trust so that the patients will call Landmark when they have needs so that we can deliver the care and improve their outcomes. The typical Landmark patient who has 5 or 6 chronic conditions only sees their primary care doctor about 2.5 times a year despite the complexity of their illnesses. And also about 30% of the Landmark patients see their primary care doctor 1 or fewer times in a year. And so we overcome this by bringing that care to patients where they're at and provide essentially concierge level care, not to those patients who can afford it, but those patients who really need it the most.
I was first introduced to Landmark when I ran into a few colleagues that I had previously worked with. They were describing to me that they were working with complex patients and they were seeing them in the home setting. It really piqued my interest because they were able to spend a lot more time with the patients and develop meaningful relationships with them.
I think a successful provider all starts with having this passion, this commitment, and this ownership of patients wherever they're at. It's not a job where you can clock in and clock out and your work is done. It's something where they need to feel this sort of responsibility and ownership for patients wherever they're at and whenever the time is. Also, I think the providers benefit when they understand that this is very much a team activity and that it's not just an individual provider seeing the patient, but they're supported by an entire team of behavioral health personnel, social workers, pharmacists, dietitians, nurse care managers, and then being able to leverage everyone's expertise to come up with the best and most effective care plans for patients.
I would highly recommend working at Landmark. There's a lot of growth opportunities. You work with great people, and we're also able to make an impact in the healthcare industry that's very groundbreaking.
Landmark is an exciting and rewarding workplace for providers. If you'd like to join us on our journey of transforming healthcare, you can learn more at landmarkhealth.org. Thank you.